Most people are concerned about the side effects of medications because the information sheet that comes with all prescription drugs lists a whole laundry list of possible symptoms. There are also many drug-bashing websites that aren't helping this situation. Let me explain what this all really means. The drug development process takes over a decade. Once a possible medication is identified, it is studied in lab animals for possible adverse effects on all of the organs, blood chemistry changes, pregnancy, fetal development, and secretion into mother's milk. It then enters phase 1 trials, where it is given to healthy adults to monitor for adverse effects. If it passes this, the drug enters phase 2, or dose-ranging trials. In these, the drug is given to people who have the disease being studied and is given at 3 or 4 different dose levels to make sure the drug is safe and to start to determine an optimal dose. Once the dose is chosen, it then enters phase 3 trials. These are large studies involving a total of 1,000 to 3,000 patients, which monitor both the effectiveness of the drug for the disease as well as to look for any side effects. Phase 3 studies are conducted in anywhere from 10 to 100 physician offices and clinics throughout the world. One of the most important aspects of clinical trials is to have an excellent team at the investigative sites because the quality of the data is in their hands. Before a patient enters a trial of an investigational drug, an extensive medical history is recorded. This includes any diseases the patient may have in addition to the one being studied, and most importantly, any symptoms that the patient experiences on a regular basis, such as recurring headache or abdominal discomfort. While the patient is participating in the study and taking what the FDA considers to be an experimental drug, everything that happens to the patient is recorded as a potential side effect of the drug. There is no effort made to establish a cause and effect relationship. However, anything that happens regularly to the patient might not need to be recorded. For example, if a patient typically gets a headache twice a month and comes in for a study visit and remarks that they've got a headache, the study team looks at the medical history, sees that this does happen with this patient, and then asks if the headache is occurring any more often than it usually does. If not, it doesn't need to be recorded. But if the study team didn't ask about headaches and didn't mark it down at the beginning of the study, then headache has to be listed as a possible side effect of the drug. This is why most drugs have common side effects such as nausea, diarrhea, and rash, because these things happen to people, and if they happen during a study, they get listed as possible side effects. My favorite, which I've seen listed on several TV commercials for medications, is viral infections. Drugs don't cause viral infections. That just means that they did the study during the winter, during the cold and flu season. Everybody is different, and that is why we sometimes see new side effects pop up after a drug has been on the market. If a side effect happens as rarely as once in every 50,000 people, it probably won't be seen in the clinical trials involving 3,000 people, but once it gets approved and is given to 10 million people over a 5-year period, then we might pick it up. That's just a part of life, like the fact that 40 to 50,000 people die in traffic accidents each year, but that doesn't stop us from driving. These reasons are why I never recommend that people read those lists of side effects. The side effects are variable, and the only important ones are the ones that happen to you. With extremely rare exception, drugs don't cause permanent side effects. If you notice a side effect, you simply stop the drug and it'll go away. In the case of the few drugs that may cause permanent side effects, the prescriber will discuss the risks with you before you start taking it. Lastly, the one thing that the information sheets and websites don't discuss is the adverse effects of not treating your disease. Please don't forget that your doctor would not have prescribed the drug if he or she thought that the benefits of taking it didn't outweigh any potential risks the drug may carry. Everything in life is a risk-benefit ratio, which we normally take in stride. My favorite example is you're driving to this appointment. A quick search on Google will show that far more people die in their cars on the road than walking on sidewalks, but you accepted the greater risk of death by driving here today because the benefit of getting here faster outweighed the increased risk of death behind the wheel. Medications are no different. The risk of not taking the drug is greater than any risk of taking it, or it wouldn't have been prescribed to you.